Hello and welcome to CSG's Spotlight On. I'm here with Dr. Husserl, an orthopedic surgeon from Orthopedic Institute of Central Jersey. Welcome, Doctor.
Thank you for having me.
Doctor just gave a very informative presentation about controversies in orthopedic care, and I'm hoping you can tell us some of the contributing factors to controversies.
Well, as an orthopedic surgeon, controversies exist on my end of the work because things are changing in medicine, technological advancements, on the workers' injured arena of controversy. We find that the patients that we treat have built-in controversies, both type of employment that they have, the type of mechanism of injury, and the histories that go along with patients who are working longer and longer in our economy.
True. And you talked about some different organizations who analyze the results of orthopedic care and how that can also contribute to controversy. Can you explain that a little bit?
Sure. Transparency is very apparent in this day and age. I myself, as an orthopedic surgeon, am subjected to peer review, publications that review the work that's done, what is considered standard of care, what is considered maybe perhaps the future. We review the past and the present. But not just ourselves. We have, as I mentioned, the transparency of medicine. Organizations, government organizations, Medicare is a strong reviewer of success or non-success in medical treatments. And then the employers themselves have organizations. Consumer health organizations are pretty on top of procedures and services that doctors offer and what's a value versus what is possibly a waste of money.
Thank you. And you talked about some of the variables that can impact treatment decisions and outcomes. Can you talk a little bit about those?
Well, as an orthopedic surgeon, we're concerned with the general health of the patient as well as the particulars of the orthopedic condition. As an example, a patient with diabetes, we're more concerned with their metabolic health. A patient who's a smoker certainly has more inherent risks in issues as a surgeon providing surgical care. Some of the variables have to do certainly with age. I think we have to recognize that as we get older, we heal a little differently than we were young. And then in particular to occupational injuries, the mechanics of the injury and the location of the injury, the history of possible previous injuries, just like in an athletic population. You need to know the entire story of what got them to that point in time.
Great. Well, thank you so much. This was really a great presentation, and thanks for joining us. Spotlight On.
Thank you.